Okay, so we'll go and get started. And then, so the presentation today is on the causes of hand pain. And the title is Everything You Need to Know. And that's a tall order to try to get everything you need to know about hand problems in the span of this lecture. So again, my website, chrisgaytonmd.com, has a lot of videos and also patient information that I'd love for you to check out. And then I also have a Facebook page at Chris Gayton MD as well. And so you can try to use that to access any information that you may need to know. Okay, so why does my hand hurt? There are lots of different reasons why your hand could hurt. And so we'll go through several different reasons today. So arthritis is the bones in the joints are having problems. Tendonitis is when the tendons that actually move the fingers, move the joints, can cause pain. They can get inflamed. Trigger finger is a specific type of tendonitis. And then carpal tunnel syndrome is a pinched nerve that can happen in your hand. Cubital tunnel syndrome is actually a pinched nerve in your elbow that can cause numbness in your small finger. If you have your elbow bent, you're talking on the phone, and then that can wake you up at night with numbness and tingling. So there are 27 different bones in the hand and the wrist. And so all of these can get arthritis, can cause pain and problems. And so the picture on the left is a picture of trigger finger. And so that's when the finger is catching and getting stuck. This can happen more in the mornings. And then the picture on the right shows carpal tunnel syndrome, where the nerve is pinched as it's going through a tight tunnel. And that picture shows shows the tendons. These are the white things, the muscles, and then also the nerves and the blood vessels. So all these things can cause problems at one time or another in your hand. So again, here's my website, chrisgaytonmd.com. And if you go to services and then hover over that and scroll down to hand and wrist, this will pull up some videos and different information that you can find. You can get to our practice website, OrthoSC, from this. You can get to your patient portal. You can book an appointment with us as well. And then it also has our contact information as well. So, I'm trying to see the chat box. So a little bit about me. I am from Warner Robins, Georgia. There's a big Air Force base there. And so a big military presence, kind of similar to how it was here. And then we're a big Little League baseball town. The Little League World Series is going on right now. My hometown won that a few years ago. And so the motto of my hometown is every day in Middle Georgia is Air Force Appreciation Day. And then I went to the University of Georgia for college. And so I'm excited about football season coming up. And so hopefully Georgia will have a good team this year. We always manage to trip up and lose a game or two, but hopefully this will be our year. But we've been saying that for 40 years now. So, and then for medical school, I went to the Medical College of Georgia in Augusta. And then I did my orthopedic residency at Wright State University in Dayton, Ohio, and then went to Pittsburgh, Pennsylvania for my hand fellowship and hand training. And then from Pittsburgh, we joined the Pittsburgh pipeline here to Myrtle Beach. And I'm I imagine at least somebody on the call probably has a connection to Pittsburgh in some way or another. There's a big contingent here in town. So again, my hand fellowship was at Allegheny General Hospital in Pittsburgh, and I'm board certified in orthopedics and hand surgery. And so my practice goes from the hand, from the fingertips all the way up to the shoulder. And so that's what I focus on. That's probably 80% of or more of what I do is from the hand to the shoulder. And then also take call at Conway Medical Center. And so there we do a lot of fractures and for various complaints. So getting back into causes of hand pain, we'll start off with the tendonitis and trigger finger, and then we'll jump around a little bit. But again, as I showed before, trigger finger is one of the most common causes of hand pain. It causes pain in your palm, and so it can cause pain when gripping or when reaching, when holding an object. And the most common cause of this is, or most common symptom is catching or pain there. And the finger, again, will get caught and get stuck down. And sometimes you actually have to take your other hand and pop it open. So I saw a couple of patients for this today that we did injections for, and then also ended up, one other one is scheduled for surgery next week. And so this little brace, this oval 8 finger splint, that can be helpful for trigger finger. And so basically it keeps that first joint of the finger out straight and keeps it from catching or getting stuck. You can get these online, and we have them in our office. And so those allow you to just rest the finger and keeps it from waking you up at night sometimes. Warm water in the mornings is also helpful for this. And then ultimately a steroid injection or surgery like we were talking about. So again, the most common treatments for hand pain, and these will kind of be consistent over basically a lot of the different things that we're talking about. The braces, like we were talking about, heat and ice. So heat in the morning, and then ice at the end of the day if it's sore, to kind of cool things down before you go to bed. That's the typical regimen that I recommend. And then the topical medicines. So this Voltaren gel is available over the counter now. You no longer need a prescription for it. Other things, people like Salonpas, Aspercreme, some of the CBD products have been helpful for patients. And then steroid injections for arthritis, tendonitis, carpal tunnel syndrome. Yeah, they can be very effective for treatment for that. So carpal tunnel syndrome next. So this causes numbness and tingling in the hand. And so a lot of times you'll wake up at night, your hand will be burning. People say it's on fire. And so they'll have to kind of shake out their hand or run it under cool water or warm water sometimes. And that also while you're driving, that can go numb if you're working on the computer. Now, a lot of times I'll see it from people who have been on their phone or tablet for long periods of time playing their games. And so that can cause pain or cramping. It commonly is worse at night, like we said. And so carpal tunnel syndrome is where the nerve is pinched as it's going through that tight ligament. And then the tendons can get swollen around the nerve, and then there's only so much space, and that cuts off the blood flow to the nerve. And so at that point, then the nerve starts causing numbness, tingling, burning pain. Usually it's the thumb, index, and the long fingers. So these first 3 fingers that cause problems. And so treatments for carpal tunnel syndrome, we talk about ergonomics, so being sitting at a good position with your arms by your side, your hands not too hunched over, and also standing. And so a lot of times we cause ourselves pain by our activities, by being hunched over the computer like we were talking about, or by doing repetitive activities for hours on end, not taking a break. And so if you can get up and do some stretches, go for a walk for a couple minutes every hour or so, that helps get the blood flowing and get you out of that same position. So like we said, steroid injections in the wrist can help with carpal tunnel syndrome. And if they do help, that's a good sign that carpal tunnel surgery will help take care of the problem. And so usually the relief is pretty dramatic with carpal tunnel surgery. Before you get the surgery, a wrist brace that keeps your wrist straight at nighttime can be helpful. And so this will keep you from bending your wrist. A lot of time while you're sleeping, you're curling your arm up underneath your chin, and that will kink off the blood flow, kind of like you're kinking on a water hose. And so the picture on the right shows how we can do carpal tunnel syndrome endoscopically with a camera, where we make a small incision in the wrist. That way you don't have the big open incision in your palm. And that's great, especially if you're trying to get back to work, then this can help get you back to work quicker. Usually people recover a little bit with less pain with this. And so that's a great option for carpal tunnel syndrome. So a little bit of the difference between carpal tunnel syndrome and arthritis. Carpal tunnel syndrome is the pinched nerve. Arthritis is more pain and swelling in the joints. And so and then rheumatoid arthritis is another type of arthritis, and that's an inflammatory arthritis. And then, so that's where your body is attacking your joints. And so typically a rheumatologist will manage this, but with anti-inflammatories or other prescription medicines that can help prevent your immune system from getting out of control. Hand arthritis is very common. And so I'm sure some of the people here are starting to get some arthritis in the finger joints. So you may be starting to get some swelling or some nodules on your fingers, also the base of the thumb. And this is normal wear and tear arthritis. And so the joint deteriorates over time, and then you lose the cartilage. You can see with this red arrow how the white shiny cartilage is gone now, and so now it's bone on bone. And so the pictures here of a normal joint and then one with osteoarthritis. So arthritis again leads to swelling in the joints, these crooked knuckles, loss of motion, stiffness, especially in the mornings. Every day is a new battle trying to get your fingers moving again and getting them loosened up. And so that's definitely one of the best treatments for arthritis, is to keep moving. So you want to get exercise, you want to stay active as much as possible. And that's one of our goals at OrthoSC, is just to try to get you back to doing what you want to do, whether that's crafts, golf, sports, even just playing with your grandkids as much as possible. So symptoms again of arthritis: dull aching pain, some grinding in the joints, swelling, stiffness in the morning, all those things that we were talking about. And then arthritis, it can vary in the way it presents. It can be a gradual onset. It can get flared up more after heavy activity, if you're working out in the yard and pulling weeds, or even had a patient said he was kayaking and that was kind of flaring up his arthritis. And then also a new injury can lead to arthritis. So if you're in a car wreck or if you have a fall, you may have had arthritis for years and never even knew it, but then the injury can set it off and cause it to start hurting all of a sudden. So depending on the location, that gives us some information about the type of arthritis that you might have. The finger joints are typically osteoarthritis. The first knuckle at the hand, that is typically more rheumatoid arthritis. And then the thumb joints can get arthritis. If it's on the side of the wrist, then that can be more tendonitis. And so again, treatment for arthritis, braces, gloves can be helpful. Some people like the copper type gloves and think that those can be helpful. Basically, whatever is comfortable for you. And sometimes you need to try more than one type of brace. I typically recommend people have 2 braces, maybe a softer wrap type thing, and then also a hard brace that keeps you from overdoing things, but it may limit your activity a little bit more. And then another thing that is more commonly being understood that contributes to arthritis and pain is our diet and the amount of inflammation that we have in our body. So diabetes is commonly leads to inflammation, and the amount of sugar in our bloodstream, all the processed foods and the white sugar that we're eating in high amounts causes problems. So more of a Mediterranean type diet, fruits and vegetables can have an anti-inflammatory effect and can help with the pain and the inflammation part of arthritis. So again, exercises and motion help with arthritis. And so this is a 6-pack exercises. So these are good for after surgery. So anytime you have surgery, I tell you 3 things. I tell you to keep your hand elevated above your heart, work on making a tight fist, and then icing it. All that helps with pain and swelling. And so the hand works as a pump. So the more you can make a fist, the more that helps pump out the swelling. And again, that helps combat the stiffness that you get in the mornings with arthritis or tendonitis. So basal joint arthritis, this is thumb arthritis, and this is pain at the bottom of the thumb down here. And so if you're opening bottles or jars, turning a key, that can cause pain at the thumb. This is more commonly seen in women, but pretty much everybody as they get to their 60s, 70s starts getting arthritis in the base of the thumb. I think I already have a little bit in mine as well. Sometimes when I'm operating, I'll feel it. And so this leads to weakness, again, with pinch or gripping. And this is, again, one of the common things that I do surgery for. So in this x-ray, you can see bone spurs here on the side. The treatment, again, can be thumb braces, the exercises, motion, and steroid injections can last for months to years sometimes for this. And so, like I said, lots of people get arthritis, but definitely not everybody needs surgery. So moving on to a tendonitis, de Quervain's tendonitis can sometimes overlap or be confused with arthritis, especially in the thumb. And so this leads to pain more on the side of the wrist here. And so new moms get this from lifting their baby. And then so gripping and lifting. So if you have this type of tendonitis, lifting with your palm up is effective, can help to rest that using the braces again that we showed that included the thumb. So these are good for both arthritis and both the tendonitis. The one on the left is more of a softer type brace, and then the one on the right is more of a stiffer brace that keeps you from bending your wrist at all. And so the surgery for thumb arthritis is where we go in and we actually take out one of the smaller bones of the thumb, and then we use the tendon to help stabilize the thumb. And so that leads to, that makes a little sling for the thumb and keeps the space and keeps the thumb from collapsing down. And so this is a great surgery when you get to the point that your thumb is keeping you from doing what you want to do. And so I think I have a few of these scheduled coming up in the next couple of weeks. So back to finger arthritis, we talked about the swelling or the nodules on your fingers, starting to get crooked fingers. You can get cyst up by your fingernail. And so this is that cyst. This is called a mucous cyst or mucoid cyst. And so these can, this top picture, the skin is getting pretty thin. This one is at risk of draining. If they start to drain, then usually that's a time that you start to recommend surgery for the cyst and for the arthritis. And so surgery, a little small surgery that we can do in our office where we just numb up your finger. We go in and we take out the cyst, and then you're in a splint for a few days and then a Band-Aid and give it time to heal. And usually that'll keep it from coming back. The problem with draining these is it attaches to the joint, as you can see on the bottom picture, and that can lead to an infection and a serious problem. So for arthritis in the tip joint of the finger, this is called the DIP joint. And so if that starts to interfere with your activities, then doing a fusion and putting a screw across the joint, that will help to decrease the pain. You're not able to bend the tip of your finger after that, but you can still make a fist with your fingers kind of straight down into your palm. And so usually that doesn't cause any real limitations with your activities or use of your hand, and you can still pinch and still do what you need to do. So moving on down the finger, the MCP and the PIP joints, there are multiple different options for this depending on what's going on with the finger. Sometimes we'll do a fusion, but the PIP joint is very important to try to keep motion in it if possible. And so a lot of times we'll do what's called a replacement for these. And so sometimes we'll do a plastic replacement or a metal one. And so the device on the top is the metal or carbon replacement. You can see that as being white on the x-ray. And then the one on the left, or the ring finger here in this picture, is the rubber knuckle. And so I typically do a lot of these. They are very reliable as far as keeping motion and taking away or giving pain relief. And then wrist arthritis, so moving down, this is where you may have had an old injury to the wrist where you had a broken bone or a broken wrist, or you injured the ligaments and the bones of the wrist start to separate here. And that leads to pain, swelling, weakness of the wrist. And so the treatment for that, again, using braces, steroid injections, if it gets beyond that, then sometimes one of the easier treatments is we go in and we actually take out 3 of the bones of the wrist here. And usually the next bone up in the wrist and the radius here, those joints are pretty well preserved. And so you can see you still have space where after we took those 3 bones out. And that keeps you being able to bend your wrist to be able to continue moving that. And then another option is where we actually do a partial wrist fusion. So on this bone, we took out the scaphoid, and that's this bone here in the wrist. And then we fuse the other 4 bones together. And that, again, allows you to move here at the radius and the lunate, but takes the pain of the arthritis away and gives you more strength than if you take out all the bones of the wrist. And then another newer option is there's actually a wrist joint replacement. And fortunately, not many people actually need that. And so, but it's becoming more common and more reliable. And so over time, that may be something that we're doing more in our practice. So this graph shows you how people typically recover after surgery. So starting here on the left, this top one is a wrist fracture. So this score is out of 100, 100 being you can't use your wrist at all. 15 down here is the normal population. And so you can see for a wrist fracture, people start off not really being able to do much of anything with their wrist. For carpal tunnel syndrome or trigger finger, you're about 50%. You can do it, use it for most things by the time you get to surgery, but you're limited. The pain is definitely bothering you. And then you can see by 3 weeks, things start getting better. And then by 6 weeks for carpal tunnel or trigger finger, most people are getting close to the normal population where we said the score is about 15. And then for a wrist fracture, you can see it takes a little bit longer, up to 24 weeks. So that's about 6 months. Most people are recovered. I always tell people it can take up to a year for you to get as good as you're going to get after surgery. And so just taking a lot of patience. But again, that's more for arthritis or bigger wrist fracture surgeries. And so for some of the smaller surgeries, you're back and you're glad you did it after even a couple of weeks. So that's all I had for us today. And so again, I'd be glad to take any questions or anything that you may have right now. And if you, and then again, my website, chrisgaytonmd.com, please check that out. And then we're going to record this webinar, and so we'll post it online as well. And so you'll be able to watch it again if you have more questions or if you wanted to look at some of the pictures again. So thank you for taking the time to attend today. And please let us know what questions you have. And so we are still doing surgery at our surgery center and then also at Conway Medical Center. And so some of the other hospitals in town have shut down, but we can still do surgery safely with, especially for patients who are vaccinated. I've been vaccinated. We're still wearing masks and trying to protect people. And so doing surgery as an outpatient, if you're not having any symptoms, if you're not sick or anything, then it's still safe to do the surgery. But again, thanks for attending. And so if you have any other questions, again, please contact us at the office, and I'd be glad to see you as a patient, to go over things more, to talk to you more about different options depending on what may be going on or what's actually causing your problem. And so we do have a question here from Diane. And so this is, how long after removal of a mucoid cyst can you go back to working on a computer? From my standpoint, you can go back as soon as possible. So as soon as you feel like you can tolerate it, even the next day, you'll have a splint on that finger to protect it. So you're going to be slower typing, but you'll have to work around it. But you can try to use the finger. And that's what I tell people with trigger finger or carpal tunnel surgeries as well, is that you can start trying to use it again the next day. Some people even go back to work the next day. And so but if you're going back to heavier lifting or like a manual labor type job, then some people are out for a few weeks after that. So good question. Another question, after trigger finger surgery, once it's released, can it get stuck again? And typically not. Typically, surgery takes care of the problem for good. Even sometimes the shots will take care of the problem for good. So you can do an injection with steroid in the hand, and sometimes that will take care of it for good. Sometimes it'll last for only a few months, and then we may try another injection. And there is a limit on the number of injections you can have for some problems. For arthritis, you can typically do multiple injections because the joint's already damaged. Let's see. Any other questions for us there? All right, another question from Sandra. I have a cyst in my palm at the bottom of my ring finger. The treatment. So that cyst, that's a common location. We commonly see that with trigger finger. And so tendonitis can cause swelling around the tendons, and that can lead to that cyst being formed. Sometimes we'll do an injection for those. Sometimes they'll actually go away on their own. And so it's a good day if that will happen. But if it keeps causing problems, then a lot of times we'll recommend surgery to take out the cyst, and that usually keeps it from coming back. If we try to drain it, the nerves are close in that area, but a steroid shot would be an option. And so then with surgery, taking it out, it's pretty rare for them to come back or continue to cause problems. But good question. And so, if there are any other questions about arthritis or anything else you may have going on with your hand, we'd be glad to answer. So typically, to get an appointment with me, we offer same-day appointments, and sometimes I may not have availability the same day, but somebody in our office will, and they can go and get you started on treatment. Usually you can get in with me within a few days. And then if I saw you the first time, I try to avoid operating on people the first time I see them, if possible. But if you have a problem that needs surgery, usually we can get to it within a week or two, depending on what it is. We try to save some space for emergencies or things that need to be done soon. If you fell and broke your wrist, then we'd want to try to get to that pretty quickly. And and then if it's more of an arthritis or carpal tunnel type thing, usually those are a little smaller surgeries, and so we have time to get to those within a week or two. Good question. All right, so I think with that, we'll kind of wrap up for today. If you enjoyed this, please let us know. Please send this to your friends and family. And again, please check out my website at chrisgaytonmd.com. And so if there are any other topics or anything that you would like us to address, then we'd like to do that for you. And so again, thanks for coming, and we'll be happy to see you or answer any questions at OrthoSC.